So, ladies and gentlemen, to summarise, and for some reflections of Scotland, please welcome back to the stage once again, Dr Nadine Buke Harris. It's been great working with you the past couple of days. I've got some questions that have been tweeted by some members of our audience. Should we do a few of those first?
Absolutely.
Okay, so let's have a look here. This is from Tim Wood. Tim asks Dr Buke Harris, what is the number one thing that policing can do as part of the ACEs movement?
I think the most important thing that policing can do is recognize the impact of ACEs, what happens with the overactivity of the stress response, and not just on the people that they're policing, but also on themselves as individuals. I think that's something that we found in a training in California, was that when we started training police officers, it was really their own experiences was the first thing that we had to deal with, and that really helped them in doing their jobs.
And we have another question from Lucy Mulvey. I think it is Lucy. I hope I've got the pronunciation correct. How would you persuade Scottish health practitioners to introduce routine inquiry?
What we've done in the US and at our center, the Center for Youth Wellness, was that when we talk to medical practitioners, the big thing is not understanding the science. When they hear the science, when they read the science, when they see the evidence, it's fairly compelling. But the biggest thing that we saw was fear. People didn't know what to do. They didn't know how to do it. They were worried about what would happen if they tried doing something and they weren't really sure or trained on it. And so we created something called the National Pediatric Practice Community on ACE Screening, and we made our tools available for free online for any medical practitioner who wants to join. And it was really about helping people get over those barriers and learning how to engage with this work. And that was probably the biggest thing that we did for health practitioners.
Okay, Nadine, thank you for that. Angela Boniface, my question is, we live in a UK where children aren't afforded equal protection, and in Scotland where children as young as 8 are criminalised. How does Dr Buke Harris see ACEs as informing the justice system?
I think it's really critical, and I'll say it's really funny. In my role, people ask me a lot of questions that are way outside of my area of expertise because I'm not a criminal justice professional. But what I do think it's critically important is that one of the things that we see and we understand is that the more we learn about the impact of ACEs on brain development or impulse control or executive functioning, for example, the more that we're able to take these things into consideration, and also the more we're able to recognize and that rather than necessarily locking children up, that there actually is another way. Like, everybody wants to support public safety, right? There's nobody who doesn't want public safety. And at the same time, we can begin to recognize that the ways to get to public safety aren't just through locking up the kids who are having bad behavior, but rather in beginning to ask these questions, what has happened to you, instead of asking what's wrong with you, and starting to do those early identification and early intervention so that we can actually chart a different path for these young people, and so that they can be a part of the solution instead of a part of the problem.
Okay. Cara asks, Q for Nadine, how can I, as a young person, this is a great question, contribute to changing attitudes towards ACEs?
Oh my goodness, there's so much that you can do. Number one is just talking about it. What we're doing right now in terms of raising awareness, talking about ACEs, letting folks know about what that means and what the implications are. But number two, it's really about, I think, sharing our own experiences, right? Being willing to be open, and I don't necessarily mean, disclosing everything, especially if you're not comfortable, but really talking about the reality of these experiences and the humanity, and recognizing what this looks like, because I don't know a single person who is more than 1 degree of separation from someone with ACEs. And when we really do recognize that it's not them, it's us. It's us, it's our loved ones, it's the people that we care about, and beginning to have these conversations so that we can destigmatize things like mental health, so that we can recognize how important it is for us to practice self-care, for us to engage in mindfulness, for us to be able to recognize what's going on, right? And then begin to take the steps to address that. And I believe the future of this movement is in the young people, right? That is what we see. When we looked at smoking, right, particularly in the US, in the United States, over the course of 20 years, we went from a 22% smoking rate among young people to a 7% smoking rate among young people. And the difference was that young people had this conversation and said, you know what? It used to be that smoking is cool, and now it's not cool anymore, right? Young people are the future of this work, and you all hold the ability to be able to recognize that the ACEs in my family are going to stop with me, right? That I am going to take the necessary steps to do the self-care, to do the practice like we heard about from James earlier on today, right? That I am not going to hand this down to my kids. That's what this generation has the capacity to do.
I think that's a great answer to leave the questions on. You have a few reflections for Scotland, I believe. Is that right?
I do.
I'll let you go over to the podium.
Oh,
if you'd
yes,
like to do that.
thank you.
Thank you.
Such a privilege for me to be here. And what we're doing right here today, is my favorite part of my job. The ability to come together and not only share a little bit about my work and what we're doing at the Center for Youth Wellness, but also to be able to hear from all of the leaders in the movement, to be able to witness the over 2,000 people who came together in this space to decide to take on ACEs and make Scotland the first ACE-aware nation. And we heard this from the start of the conference, from the First Minister. We heard it from the Deputy First Minister. We heard about talking about prevention and early intervention. But we also recognize that this is not something that's going to come down from, the heights of government. This is something that each one of us takes on and engages with because it's personal. When I was sitting in the audience today, I heard people talking about compassion. I heard people talking about courage and collaboration. I heard about creating environments of safety, love, and attachment. That's not something that we do simply as a policy decision. That's something that each and every one of us creates either in our household or in the school environment where we're working, or whatever our capacities are. And it's part of the conversation, a very important part of the conversation. We heard about ACEs and poverty. And that's something that I think that we all can intuitively understand. How people with high ACEs might be more likely to end up in poverty. And once they're in poverty, how they have fewer resources to help and heal. So we have to recognize the impact of ACEs on our vulnerable populations. But we cannot stop the conversation there. We also have to recognize that ACEs are happening in some of our most elegant homes and communities. And that's where it likes to hide, right? In wealthy communities, no one suspects. Or, if they do suspect, they don't dare to ask, right? Because wouldn't that be rude? I believe it's critically important for us to come together to recognize that ACEs are a public health threat across the entire spectrum of our community. And when we recognize that, that's when we have the ability to see that this isn't a rich or poor issue. This isn't a progressive or conservative issue. This is an issue that affects all of us. And so together, we must come together to address the root causes of ACEs, to prevent, to do early identification, and to heal. You know, one of the things that I heard today that was most resonant to me, that really deeply affected me, was the saying, start where you are, do what you can. I love that. I love it in the simplicity. When I first read the ACE study, I recognized it to be true. And I recognized it to be true not just in my patients, but one of the things that I talk about in my book is about seeing the effects of ACEs in my own family and recognizing what that feels like. And so when I was seeing these patterns in my patients and I read the science, and it just made so much sense to me. For me, as a doctor, it was about start where you are, do what you can. And so I did what I could as a pediatrician. What I witnessed today on the stage, and I hope that every one of you in this room felt, was person after person after person who was starting where they were and who's doing what they could. And whether it was as a teacher or as a psychologist or as a doctor or a police officer, a parent, a grandparent, a brother, a sister, or it's even having that self-compassion to be able to recognize how ACEs may be affecting you in your life and begin to practice that self-care. What we do, these little bits, they add up. And I want to leave you all with a few of the final words from my book because it's something that I believe in very deeply. I believe that we can rewrite the story of adversity and break the intergenerational cycle of toxic stress. I wrote this book for all of the parents, the step-parents, the foster parents, the grandparents and caregivers of all stripes who are trying to figure out how to give the little people in their care the best shot in this world, despite the difficulties that life throws their way, and often despite their own histories of adversity. I wrote it for all the children and young people in this world who are facing outsized challenges, and for the adults whose health is being shaped by the legacy of their childhoods. My hope is to inspire conversations around dinner tables, in doctors' offices, at PTA meetings, in courtrooms, and at city councils. But my greatest hope is to inspire action, big and small. Whether it's simply learning to recognize when your own stress response is activated and figuring out a way to respond in a way that's healthy and not harmful to the people that we love, or becoming a mentor to a child in need, or talking to your doctor. There's something that every one of us can do to change the way that we, as a society, respond to ACEs. And I believe when we each find the courage to look this problem in the face, we will have the power to transform not only our health, but our world. Thank you so much for being here. Thank you. Nation, thank you for taking this home. Thank you for taking this into your schools, into our justice system, into our hospitals, back to our children, to our homeless shelters. Thank you. We are doing it. Thank you.
Ladies and gentlemen, Dr. Nadine Buke Harris.